The following portion of Daytime is sponsored by the Jason Facial Rejuvenation Institute. As we age, everything starts to sag a little, and oftentimes the neck becomes loose and a little turkey-like. Lifting that area can make a dramatic difference in how you look, and there are lots of options on how to do that, including a new procedure that doesn't require an incision at all. The face doctor, Michael Jason, is here from the Jason Facial Rejuvenation Institute, and he has brought along patient Jamie Brahino, and she is also his surgical technician. Good to have you both here.
Thank you.
Thank you.
So let's talk about this area. It seems to go first, I think, for a lot of people.
Well, it's probably the most commonly complained about part of aging in the face and neck that we run across. And we've had a lot of recent inquiries from a lot of different people about what the options are for necks. So I thought we'd do a little review again, even though we've talked about some of this in the past, but there is a brand new procedure that we have available that is a little bit revolutionary.
Oh, good. Yes, it is revolutionary. I saw the video. You won't believe it. But let's go back first to the Simplicity Lift.
Okay, and this is again, a small incision procedure where the incision's around the ear, and what we're going to do is tighten the cheeks, the jawline, and the neck. This is an example of a patient just 2 weeks post-op, so you can see how good you can look early on in the healing phase with that type of procedure. And I think we have another view showing her as well, and you can see how the neck's tightened, the wrinkles are gone, the laxity's gone, but the jawline and the cheek are also improved.
That is dramatic. Can you just get instead of having the Simplicity, can you just get a neck lift?
Yes, some people are just interested in what's going on below the jawline and not so much what's going on above the jawline. So for that we have a neck lift where there's a 1-inch incision. We do liposuction to take the fatty component out, and then there's a muscle that gets lax called the platysma muscle, and we actually suture the muscle together in the midline to get the support restored and then recreate that angle between the neck and the chin. And this is a very good demonstration here with both of these. And that's a neck lift done with some liposuction of the jowl.
That is incredible. And they didn't need anything above the neck. I mean, that was really their problem area, right?
We just worked right here at the jawline with liposuction and did the rest of the work underneath with a 1-inch incision, no skin removal.
Now, what about somebody who has a little issue up here and a little issue down there? Can you put them both together?
For those who want maximal correction and still want a small incision procedure, that's what we do. We combine a Simplicity lift with the Simplicity neck lift, and this is a good example of that as well.
Look at that, and I don't see any scar at all.
Well, there's a little one around her ear and a very small one underneath her chin, but they're very well camouflaged.
They certainly are. Now let's talk about this iGuide trampoline lift. This is the newest of the new.
Okay, well let's talk about this.
Okay.
Is we take a couple of what's called suture rods that have a suture connected to either one, and they are connected to a light handle which will illuminate through the skin to make sure we're judging the depth of our dissection. And basically what we do is take the suture rod and pass it and weave it back and forth through a series of small punctures across the jawline, and we basically thread it across like we would shoelaces and then tie it down, and as we tie it down it cinches everything up, gives support to the muscle, and helps get a better angle restored between the neck and the chin.
And when you say punctures, there's no scar after.
Right, and there's no suture. It's just a small little stab or a small little puncture that closes up on its own.
So it's like lacing up a shoe. What was your issue? What did you want to have changed?
Just my neck, and I about hounded him every day to do it for me.
Was it just extra skin? There you are. That's before. Oh my. Look at you. And you're not a large person. It was just that's where the fat was collecting underneath your chin?
It's just something that was hereditary in my family and wanted it taken care of.
Wow.
I hated my profile.
That is dramatic. What a nice difference. Now, why wouldn't you just go in with liposuction? What happens if you just do that?
Well, for people in the age range of 35 to 40 or beyond, the muscle laxity starts to become an issue. So the liposuction will take care of one component, but doesn't get the muscle laxity addressed. So if we suture the muscle together, we can do that like we do in the neck lift. With this, we're weaving the suture back and forth underneath the jaw and basically making a trampoline-like support and tying it down like you would a shoelace.
Well, I was watching the video, and it is like almost putting a shoelace together underneath, and it just goes whoop, right back up.
Pass it through, we turn it around, change directions, come back through the other side, go back across, and then we're done.
And Jamie, I don't see any evidence of this at all, except that you have a nice looking
I have a nice
chin line
neckline and nice jawline.
How do you feel?
Happy, very happy.
Oh, okay, well, Jamie and Dr. Michael Jason of the Jason Facial Rejuvenation Institute, thank you both very, very much. And to get your questions answered or to schedule a consultation with Dr. Jason, call 813-975-3223 or log on to jasonfacial.com. Don't go away. Daytime will be right back. The preceding portion of Daytime was sponsored by the Jason Facial Rejuvenation Institute.